Good morning, everybody, and welcome to the Greater Lehigh Valley Chamber of Commerce's virtual summit, Stepping Out of the COVID Shadow, Making Your Mental Health a Priority, presented by your Healthcare Committee and the Business Council here at the Chamber. I'm Bill Blows, a CPA and Managing Partner of RLB Accountants here in the Valley. I also serve as Chairman of the Healthcare Committee. Very quickly, I wanted to say thank you to everybody and all my friends on the Healthcare Committee that helped us plan this summit today, but it's not just about planning this summit. We meet every month to discuss issues involving your healthcare policy. For example, we reviewed Senator Casey's proposed Senate Bill number 3763, and that would provide much needed recognition and rewards to frontline healthcare workers during this pandemic. While we think that the senator's heart is in the right place with that bill, we just believe that the bill went a little too far in spending. There's no limit to the spending they were going to do on this. So we did reach out to the senator's office and asked him to make some changes to the proposal. We also put some support behind House Bill 100, which would allow nurse practitioners to practice independently, which we believe would result in lower healthcare costs to patients. Just last week, that bill cleared another hurdle when the physicians of the Pennsylvania Medical Society actually approved the bill. So now we just need our legislators to get on board. We think that's a big one. It could save a lot of you a lot of money in healthcare costs in the future if we can get those nurse practitioners working independently. Then, of course, there's the education that we provide to you, the members of the Chamber, through our annual summit. I don't have to tell you how stressful 2020 has been. It's just been that year that seems to be getting worse by the day. Professionally, I can tell you it's been the most difficult tax season I've ever experienced. And listen, just so you know, when the ball drops on 2021, it doesn't magically disappear. So we're going to be dealing with this new normal for a long time. So I think that this summit is going to be really informative for you. You got a lot of terrific speakers that are going to be on the panel today. It's going to be really helpful to you, for both you as an employer and you and your employee. But before we get to that, I want to turn to a terrific friend of ours, been a great friend of the Chamber. He himself has been an incredible advocate of mental health issues. I want to introduce to you now our friend, State Representative Mike Schlossberg. Mike, take it away.
Hello, my friends. State Representative Mike Schlossberg here, joining you all digitally from the confines of my home office. It's a pleasure to be speaking with you today. Of course, like the rest of you, I'm so sad that we can't actually be together in person, but I think it's deeply appropriate that you have chosen to have mental health be the topic of this year's summit, given the severe and, I would argue, underappreciated impacts that COVID is ultimately going to have on mental health. We know that before March of this year, we as a country and as a Commonwealth were facing real mental health challenges. Those challenges have obviously accelerated since the outbreak of COVID. The good news, such as it is that before COVID began, at least in this state, we were starting to have a real comprehensive conversation around mental illness. The governor launched a suicide prevention task force that came up with a comprehensive suicide prevention plan, the Reach Out PA initiative that was going to really put a lot of effort and resources into mental health. In fact, he announced that at a press conference in January of 2020, and then things went downhill. COVID has changed the world, but it has also changed our ability to deal with mental illness. Now, you don't need me to tell you that we are in the middle of a mental health crisis fueled by COVID and the ongoing economic tragedy that has unfolded as a result of it. A study from the University of Boston used the PHQ-9 screening tool. Now, a couple of years ago, it tested adults for depression and found that about 8.5% of American adults screened positive for depression. A recent examination a few months ago tripled the amount of people who would screen positive for depression. So we were looking at a real crisis in terms of insurance, workforce, and capacity. The issues are massive, but I still have faith. People with depression in the long run are and can be resilient. That has been my experience, but I was always lucky enough to get the treatment that I needed. If we can do that as a society, if we can continue to destigmatize the issue of mental illness, we can put real resources behind it. We can give people a chance to live a life with hope and to live a good and normal life. So on that note, have a wonderful summit. I hope it's informative, educational, and most importantly, I hope it moves the ball forward for an issue that is certainly important to me, but more importantly, important to all of you and my constituents as well. Thanks so much for your attendance and for your passion on this one. Have a wonderful summit.
Thank you, Representative Schlossberg, for those words. You're in for a great program today, and before we kick things off, let's take a minute to recognize and thank today's sponsors. Our presenting sponsor is Capital Blue Cross. Capital Blue Cross is a strategic partner of the Chamber, offering signature, price advantage plans for Chamber members. Thanks to Ann Baum and the team at Capital Blue Cross. Chamber Health Marketplace is also a platinum sponsor of today's Healthcare Summit and another strategic partner, helping you access and navigate Chamber health insurance plans. Another platinum sponsor is Highmark and Populitics. Thanks to Jane, John, and Jacqueline for being with us today. Here are a few words from Highmark.
Good morning. I'm John Loughborough, Vice President of Eastern Pennsylvania Commercial Markets for Highmark. Welcome to the Lehigh Valley Virtual Healthcare Summit. Highmark is proud to be a sponsor of this event, not only to support the work of the Greater Lehigh Valley Chamber of Commerce, but to support the incredibly important conversation on hand today, mental health. As employers, it's vital that we implement the proper protocol and benefits to ensure our employees have the resources they need to manage their physical and mental health. Amid COVID-19, the need for mental health support is greater than ever before. The pandemic has brought many emotions, many of which can lead to changes in your physical health and well-being. During an unprecedented health crisis, one thing that employers need to be able to rely on is their healthcare coverage. Employers and their employees want to have peace of mind knowing that who they choose for their coverage is going to provide the best care possible in times of need. Highmark is proud to offer Lehigh Valley Flex Blue in collaboration with Lehigh Valley Health Network. This partnership ensures quality care for members, improved outcomes for patients, and ultimately lowers future healthcare costs. The Lehigh Valley Flex Blue plan allows for greater coordination of care and access to local hospitals and doctors that are consistently recognized for quality care. Not only does this plan keep costs in mind for employers, but it provides stable and reliable coverage in good times and in bad. Healthcare provided in an efficient manner, without duplication of care and unnecessary steps, allows your employees to access the care they need when they need it. At Highmark, we want to put your mind at ease, knowing that you can count on us for your healthcare needs when you need it most. Thank you for joining us today, and on behalf of Highmark Blue Shield, enjoy the Healthcare Summit.
Our gold sponsors, Equinox Benefits Consulting, thanks to Tom Groves and the team at Equinox, and Workforce Board Lehigh Valley, thank you Nancy Dishnet. Our silver sponsors, PSECU, RCN Business, and RLB Accountants. Our bronze sponsors, B. Braun Medical, McGriff Insurance Services, Myers Insurance, Andra Hewitt Associates, Smooth Roots CBD, Stewart Benefits Consulting, Team Logic IT, and St. Luke's University Health Network. Thank you again, and a big round of applause for all of our sponsors. Now, to introduce the panel, please welcome Lehigh Valley Executive and Vice President for Capital Blue Cross, Ann Baum.
Thank you, Gina. On behalf of Capital Blue Cross, I would like to welcome everyone to today's Healthcare Summit. Our topic for our panel today is mental health and how COVID-19 has impacted business owners and their employees. Our panel of experts will provide you with insight from the perspective of mental health providers, employee assistance programs, and human resources professionals. And they will cover the current mental health crisis that has been magnified by the COVID-19 pandemic and what businesses can do to help their employees. It is my pleasure to now introduce to you our moderator and the chair of our Healthcare Policy Committee, Bill Bloss from RLB Accountants. Bill, it's all yours.
So once again this year, folks, we've got a terrific panel lined up for you this year. Experts in the field, given, as I mentioned earlier, the circumstances we're dealing with this never-ending 2020. Put together a great panel. I'll start with introducing the Director of Human Resources, Risk and Safety for the City of Allentown, Meloney Sallie-Dosunmu. I've also got Sally, welcome, and thank you very much for joining us this morning.
Thank you for having me. It's an honor to be here.
You're welcome. I appreciate the sacrifices you're making here. I then also have the National Director of Business Development and Marketing for Mazzitti and Sullivan EAP Services, gentleman by the name of John Troutman. John, welcome to the panel today.
Thanks so much for having me. It's great to be here.
And John, be prepared. I got a very basic question for you. And for many of our panelists today, or many of our guests today, what is an EAP? So we'll get to that. And then a good friend of mine also happens to be a client. I hope he doesn't mind my saying, but he's a terrific gentleman. He's a board licensed psychologist and executive director of the Center for Integrated and Behavioral Health in Bethlehem. We got Dr. Roger McFillin with us today. Roger, welcome. Thank you for joining us.
Thank you. It's my pleasure. Looking forward to it.
Great. And folks, I got news for you. This is going to be a terrific discussion. But I want to really get started with something very basic. And Dr. McFillin, I'll start with you. And the basic question is, obviously, we're dealing with a lot of stress given this pandemic. And we got economic stresses we're dealing with, work stresses, family stresses. We're dealing with educating our children at home. How do I know if too much is too much, right? So how do I know? I'm dealing with different stress levels, so many different issues I'm dealing with on a daily basis. How do I know when I've got a problem I need to deal with and perhaps should be seeking professional help?
Yeah, it's a really good question, Bill. I think the first thing that I want to acknowledge is the inherent resiliency that we all have as human beings. And when we're facing some of the crises that we're facing as a country and really as a world, we're going to have to acknowledge that we're going to be experiencing a wide range of emotions that are going to be normal and expected given the conditions. And so when we talk about when is the right time to seek out help, I think the first thing we have to kind of look at is the degree of impairment that may exist in our own lives. So we all have a sense of like what is typical or what are normal for us. We have our own life histories, we have our established coping strategies. Generally, I think most human beings we're flexible and we're adaptive. However, sometimes the circumstances can, overwhelm us and, impact the way that we may be sleeping, the way we may be eating, the way we engage in our relationships. So I'd want to first just acknowledge major changes that exist that are impairing their ability to function in the way that would be typical. And so what could that mean? I always look at sleep. It is for anyone who's had challenges with sleep in their own personal life, this has profound impacts on your ability to concentrate, to regulate your emotions, to be able to complete the tasks that are necessary within your work life, your personal life. This can also impact other areas, like some things that we look at as turning to substances as a way to try to relieve the stress that exists in your own life. So if you find yourself, using illicit drugs or drinking more than what would be typical, that would be certainly a red flag. Conflict that does exist, feelings of like loneliness and despair and considering if life may be worth living, any, patterns of behavior that could be viewed as like self-injurious or self-destructive, all those things are like legitimately important that you're going to want to seek out some professional support and evaluation, because you're falling into some patterns of coping that are essentially self-destructive and quite dangerous. And when we see many mental health conditions are what we consider episodic, meaning that there's a prompting event or environmental stressor, and then there's a period of time, and it can resolve itself with the appropriate changes that might exist. And so it does sometimes require professional help, in that way. For people who've been experiencing more what we'll call chronic mental health related issues, and this could be related to childhood related traumas or lifetimes of like abuse, neglect, or oppression in some way that's been affecting them, those are most important, like to have consistent support during those periods of time. But for this period of time, I want to just say there is what would be considered normal and expected reactions given the circumstances.
And I think, I don't want to make light of this, but I think we've all seen evidence of the substance abuse just when we walk into a state liquor store and see empty shelves. And literally there are empty shelves there that can't keep the shelves stocked with people's alcohol of choice. It's amazing to me how people turn to those alternative substances, if you will. I mean, CBD came up in a conversation with someone. Is that an alternative people should be considering? That comes with a whole nother host of issues. And, I'll turn to you, Melanie, and that is, I talk about use of alternative substances, whether it be alcohol or CBD. I think as a human resources specialist, you've got to be seeing some things and have your concerns as to when you recognize someone may be dealing with a problem that maybe should be seeking the help of a Dr. McFillin, but rather they're turning to other alternatives, and it could be impacting their job, their performance at work. What are your thoughts on that, Melanie?
Yeah, I mean, the use of substances and the, I guess, increased stress does oftentimes have an impact on people's work. And I mean, I haven't really seen an increase in that during the pandemic. I mean, that's pretty fortunate, but it has been an issue or a concern of ours through even before the pandemic. Now we do have an EAP, and even our discipline process, every discipline document that we have, the templates that we have, we recommend people seek the EAP. And the reason for that is sometimes there are underlying circumstances or underlying situations that are impacting behavior that they bring to work. As the doctor just mentioned, sometimes it's childhood trauma. It could be PTSD coming out of the military. Sometimes it's even workplace trauma. We have police officers, we have fighters that face some pretty trying situations at work. But we are very diligent about offering the EAP services to employees who are struggling with anything. We make an assumption that there could be something underlying. It's really up to the employee to take advantage of that or not. But we do believe that that support and help in the mental health arena is critical to people being successful at work.
I'm going to hold you right there, Melanie, for just a quick moment. John, you're on, my friend. What is an EAP?
That's a great question, and that's one we get asked quite often. So EAPs get painted in a very wide brush, and they take many different shapes and sizes. So EAPs stand for Employee Assistance Program. Again, every provider is different, and I'm not necessarily here to just promote mine that I represent, because right now, and I'm sure we would all agree, any EAP use right now is a good plan. To have something right now is better than nothing. And we're seeing it not just across the nation, but certainly across this planet, that mental health issues are on the rise. So in the very briefest of terms, an EAP program is set up for employees to use for the support. If it's just covering them or if it's covering the household, you need to check with that plan, but it's set up to support them with mental health issues, counseling, life coaching. And again, depending on what plan you have, that may go into other areas that are involved with stress, like it could be elder care, it could be some personal financial counseling, all those areas that make up a person's well-being that can be stressors, whether it's, and again, the doctor referred to this as well, diet issues, all those things. How we manage our stress or how we don't manage our stress is coming to a height right now. So that's what an EAP plan is, to support those areas where stressors are on the rise, or we have other mental health issues that are taking place that are impacting our lives, including our jobs.
So to be clear, John, is this the EAP programs, are they available through all health insurance carriers? Is that it?
Yeah, again, so I can't speak on every single carrier that's out there. So again, if you're an employer, check first with your health plan. Oftentimes these plans regarding EAPs get embedded and they are not used because employees don't know they're there. So if you're an employer, talk to your benefit advisor, become more familiar with the plan you have. For that matter, all benefits don't get used because people just don't know they're there. So employers, check with your benefit advisor, be up to date. I know a number of carriers have boosted their plans with EAP through this time. If you're an employee, again, talk to a person in HR, ask the questions, know how to access the EAP. It's there for a reason and it's there to be used.
So To be clear, for all of you that are employers out there, check with your carrier, make sure that that plan carries an EAP plan or program, and let it be known to your employees that it's available to them. I'm assuming, John, this is strictly confidential, right? No one's going to know that you're seeking that help through an EAP?
Absolutely. And that's the big part of the success of that EAP program, is so that all employees know that when they reach out, for assistance, for some support, it's not going to be passed on. All their information is going to be confidential. The only time that may be held into question or information may be released is when they may be harming themselves or someone else. So just to differentiate that, that's the only time, and it's for the best person's safety and well-being in mind. But other than that case, everything is completely confidential.
So, Doctor, hearing about the EAP program, it makes me think a little bit of telemedicine, if you will, and telehealth options that are out there. Is that something that you would recommend people seek, or do you recommend making an appointment with you and coming and visiting your office or one of your practitioners or the like?
Yeah, I think the answer to the question is it depends. Obviously, it's actually an incredible tool that has been able to advance our abilities to be able to reach more people. But in reality, there are situations where it is in someone's best interest to be able to come into an office, meet and be evaluated in a one-on-one situation. Sometimes just the simple act of leaving one's home is certainly therapeutic, and to be engaging with another person, and that can be part of the therapy if you're in like a behavioral activation treatment for depression, for example. Other situations, and this is in areas of expertise for me personally, is I'm gonna be treating some people who are low weight anorexia, for example, or have lost significant weight due to mental health related problems, and being able to manage them in an office as far as like weekly weigh-ins, and just being able to visually observe their health and engage with them at that point is really important. But for the most part, like, we're starting to see some early data on research on the effectiveness of telehealth compared to in office, and it's very promising. In fact, one of the things that I find incredibly helpful is when you're in a practice like ours, which is an active, skill-based, goal-focused treatment like cognitive behavioral therapy. We're often doing things like behavioral experiments or exposure-based treatments, and being able to work with them in their home environments to do some of these things is really advancing our treatment and advancing our care. The other thing that's, I think, really important is if you think about traditional mental health care, it's like you're setting up an appointment once a week or potentially longer or potentially less in office. How about being able to help people in the moment when they need it, like from a coaching model? So we've been setting that up in our practice, especially if you're working with someone who may be abusing substances or self-injurious or suicidal. The ability for them to reach out to you and for you to be able to jump on a Zoom call at home and work with them for sometimes 15, 20 minutes can be more effective than the hour session you had with them early in the week. So it's also the quality of care and the quality of intervention. But without a doubt, I think the telehealth is going to be advancing our care and advancing our treatments.
That's powerful. That's powerful. I'm glad to hear that. I'm glad to see that telemedicine is working for folks, and can only get better, and you're seeing some promising results. Doctor, I want to ask you one other thing. With the pandemic and everybody's working from home, or many are working from home, obviously. Are you seeing cases related specifically to, and you alluded a few moments ago, it's therapeutic just to get out of your house? With everyone working from home, I would think that that's got to be stressful for them as well. Are you seeing cases like that?
Absolutely. So it's interesting. We're in a time where we're talking public health and protecting from a virus. I have concerns for all the unintended consequences of the measures that we're taking as a society. We are seeing significant increases in suicide attempts and completions, substance abuse, domestic violence, anxiety. So there is significant fear that is amongst our population. Now you add that on into social isolation. So working from home takes people out of that face-to-face day-to-day interaction and engagement And then you're trying to also balance trying to run a household, or if your kids are attempting school virtually and all the challenge that exists there. So there is absolutely, no doubt in my mind that there are many unintended consequences from a public health perspective and trying to protect from a virus that affects a certain portion of the population. But are we really thinking about public health generally in terms of isolation, loneliness, depression, suicide, substance abuse?
Great stuff. Melanie, I see you shaking your head. As a human resources person, I can't help but wonder what you're doing with, I'm going to say, permitting folks. I'm old school, right? I see it as a privilege to be able to work from home. But how are you handling that in your office? And what should employers be considering as they're continuing to allow folks to work from home?
Yeah, we have become so much more flexible. I mean, you might imagine being a government organization that flexibility has not always been a part of our mantra, but this pandemic has really forced us to think more progressively and more widely about how people get their work done, where the work happens, how it happens. And so we do have, in order to promote the social distancing and also the flexibility that people need to get their work done, we have expanded who can work from home, how they can work from home, and also scheduling. We in the past had very stringent schedules and held people very tightly to those schedules, but we've needed to be a lot more flexible with when the work gets done. And so in order to support parents who need to educate and who need to be there so that their children can be educated virtually, people who have childcare centers that are no longer functioning because of the pandemic, or they're functioning in a different way. So we have become a lot more flexible. And so what are some of the things that we have to take into consideration? I mean, of course, performance management is still important, but so you have to balance that. It does require another skill set for supervisors and managers, those who are supervising the work of others. But I think it just makes you a lot more attentive to your employees. Now, as we talk about some of the stressors that there are in the environment right now, it does add stressors to the supervisors because who are ultimately accountable for the work of their people, because now we have to figure out how to get the work done. We have to figure out how to monitor the work and how to manage performance with people that I'm typically able to walk in their office or, walk on their work site and see them, and now I can't. So it has, I think that it has forced us to kind of raise our game as leaders, as managers, but it's really important. We've got a great workforce. We've got incredible employees. It's important for us to be able to recognize those stressors, recognize what people are dealing with, and become as flexible as we can, as long as the work is getting done the way it needs to.
Yeah, I mean, you bring a good point. I like to say quite often here that there is no playbook for this, right? I mean, the last pandemic was 100 years ago. People walk in my office and say, Bill, what are we doing about this? I don't know. Give me some time to think about this. I don't. You bring up a great point, Melanie. We talk about our employees and helping them deal with the stresses of this pandemic and work-home balance issues. Truth of the matter is, it's not just the employees, it's the employers as well. It's a whole new set of stresses.
It is.
I talk about having to manage risk. And when I talk about that, it's in my office, is what's the worst case scenario we can have here, right? Someone getting this illness or someone not being able to manage the stresses of this pandemic. And then it falls on our shoulders as employers because perhaps we didn't do enough to protect them. That's always a concern. So that stress is always there for us as employers, I know. John, but I got to ask you then, what kind of cases are you seeing in terms of employees or even supervisors calling saying, what do I do?
Yeah, that's very interesting, Bill. And again, I would be interested to know what Dr. McFillin experienced in his universe, because what we saw starting out at the initial stages of the pandemic, there was a stark silence, if you will, of phone calls, which to me, of course, be representing EAPs, representing a specific one, of course, I assumed that there would have been phones ringing off the hook. But I think it was my own personal take was just that people were trying to adjust. They were so caught off guard with how to move forward. They became very protectionary in their environment. So I don't know if that's what any of you saw, or Doctor, if that's what you experienced, but that's what we initially saw. But shortly thereafter, I would say about a week and a half, there was a sharp spike in both with our current clients as well as people across the country. And what was interesting, Bill, is they were businesses of all sizes. So we've added groups from companies of 6 employees to several thousand in multiple states, and quite frankly, in Canada and Mexico, because they wanted it installed yesterday. They wanted their employees to get these services yesterday. So the resounding gong, if you will, was just ringing of help us with our employees manage the new stress level, because they've all seen it. They've all experienced it, trying to adapt to working from home. And as Melanie did a great job explaining of the great work they're doing there, that's a great example of what other organizations have done as well, been more flexible. But even so, you still have Junior or Susie in the corner to handle and to manage and to take care of, or my Irish setter that I hope doesn't bark in the background during this presentation. So all these other things we're managing and juggling, that's been the main thing. Sadly, we've seen a terrible spike in suicides and in attempted suicide. So we have been to be on site for critical incident stress management. And that's something that I hope I'm wrong, but I believe is going to be ongoing as businesses not just try to get back into what is going to be the future. We'll know when we get there, but it's still going to be a tremendous transition in that time. And they need to be aware to use their EAP, use those counseling services that they do have. And if they don't, reach out to their benefit advisor for their advice on how to move forward.
Yeah, I mean, my gut tells me, John, I have to agree that it seems that people think that when the ball drops in 2021, it's all going to magically disappear, and it's not. It's going to continue, unfortunately. So, Roger, Doctor, I'm sure you've seen a spike in cases. You mentioned sleep being one thing that we can do. If we can get a normal sleep pattern and enjoy more sleep, that's certainly helpful. Any other things you can recommend that perhaps can help folks deal with these stresses?
Absolutely. Probably the most effective, quote unquote, antidepressant that ever existed is exercise. We are designed as human beings to move, and modern society has left us becoming, unfortunately, less active and just sedentary. It's led to weight gain, poor food choices, and it has an indelible impact on our developing health and our brain, which is in part, it does contribute to a rise in mental health related difficulties. The other thing I'm going to add is we're in a time where we are overloaded and inundated with information, and that information is often very threat oriented. I would say that the pandemic is only one piece of the stress that people are experiencing. The other is the divisiveness that exists in our political system and our country, and fears about our democracy moving forward, hopelessness about where we're going as a culture and a society. There's civil unrest that exists, political strife. People are getting moved to the extremes. We have social media and media feeding it for what appears to be political purposes. And so when we talk about sleep problems, we have people who are worried, who might be the last thing they do before they go to bed is they're watching news. And if you do turn on the news, you know what I'm talking about. And we have good information that just is demonstrating actually significant increases that have occurred since around 2006. So when mobile phones and smartphones and the ability to go on things like Twitter and other things have led to just increased anxiety, stress, and depression. Yes, it's spiking now in 2020 for obvious reasons, but we've seen a decline in our country for various reasons. So I'm going to say, get off social media, get off your phone. If we're talking here about mental health and work, and we're talking about flexibility to get things done, we need to get people off their phones and their electronic devices more. and to engage with your friends and your family, to engage with nature, to engage with exercise, to try to develop sleep patterns, to shut off all your electronics. I would recommend 2 hours prior to bedtime. So there's a number of things that are really problematic in who we are as a culture and a society that doesn't lend itself to sound mental health.
Fascinating, fascinating. Hey, Melanie, something that's been burning in my mind about this as an employer is twofold. Number one, as an employer, do I have a responsibility, do you think, to recognize when someone may be dealing with something that they should be seeking help for? And on the flip side, do I run a risk of not recognizing it? And if so, what kind of trouble can I get myself into if I don't step up and try to get help for that individual?
So yeah, in my mind, we do have a responsibility. I mean, we are stewards of the workforce. These are people who are, it's a twofold contract, right? They come and provide a service, but we also have to, I believe, we have a responsibility to provide some support. So yeah, I do believe that it is our responsibility to pay attention, to provide some support if necessary. That's why we have the EAP. We have also enhanced the mental health offering within our benefits, our normal benefits. People are able to actually get more assistance through the normal benefits. So they have the EAP for kind of emergency situations, but they also have the option of some more long-term care beyond the EAP as well. And I do believe that it is our responsibility. I mean, we are accountable. And I mean, people do have their own accountability for their own mental health, but we also, as employees, we are stewards of the workforce. And so, yes, I believe we do. What happens if we don't? I don't know that we have legal implications, but I mean, we are committed to providing an engaging workplace. We care about the employees, and what happens, people check out. They check out mentally. They become disengaged. The performance declines. You have people not knowing how to treat each other because there's so much anxiety and stress, and that deteriorates the culture of the workplace. And so we have to keep our eyes on that. We need to pay attention to how people are feeling at work. We have to pay attention to how people are treating each other, how are managers talking to their employees. I do believe that is our responsibility. How can we provide good services to the citizens of Allentown if the employees are not well adjusted? So I do think it's really, really important that we are, as I said before, stewards of the workforce.
John, Melanie mentioned a couple of times here that she seems to be, I'm going to put some words in her mouth here, but seems to be a big fan of the EAP program. Could you just walk me through a process as to how this works? An employee contacts you, take it from there for me.
Yeah, and again, every EAP is different. So some employee programs, they can contact directly with the provider and set up their own appointment. Other plans, we contact directly with the EAP program, and they'll be talking with a person representing the EAP that will, quite frankly, lower their stress on that initial call and try to understand what they're looking for, who they would feel most comfortable meeting with, whether that will be face-to-face, virtually, whatever they're most comfortable with. And they would just go through some regular questions, who their healthcare provider would be. So if they need to have some sessions beyond their covered sessions with the EAP program, that would go into their health insurance program. They're also going to ask demographically where they are, zip code, to understand within that network of the EAP program to make sure that they have those providers in place. They're also going to ask questions like faith, if that's a part of that person's interest, and what faith, to make sure they can line a person up of similar background. Again, to lower those barriers. There's enough barriers in mental health, right? There's enough stigma that's there. So I'll say the most of the EAPs out there will do their best to try to reduce the stress on the call, to get the employee engaged right at the very beginning and to set up those sessions. Oftentimes they can get a session lined up with a provider that day or the next day. And again, Bill, we're talking about, what type of scenario is this? So if this would be a severe case where And I'm not watering down any from not being severe, but if this is a situation where a person could be harming themselves or someone else, they're going to immediately get in contact with the emergency room and the authorities to make sure this person's getting immediate attention. So if it's an employee, yeah, contact them. It's not as threatening as it might be. They're gonna be your biggest fan. They're gonna work with you to help you get the help you need and see what those things are. And if it's, multiple things, they'll do what they can to help you out in the long run.
John, you mentioned the one word that I wanted to ask Dr. McFillin about, and that is stigma. But I'll ask you first, John, that is, are you seeing that stigma, is it lessening, or are people still struggling with that and not being able to get over the hump to seek that care because of that stigma?
So again, and maybe this is referring back to what Meloney shared earlier. So what we have seen great success in, Bill, is when supervisors and managers embrace the EAP. And I'm not talking about an orientation program, although that's great. I'm not talking about reading the material. That's a step. I'm talking about when they themselves at least schedule one initial session so that when the employees have an issue, they can erase the biggest barrier by saying, I've used this service. I found it to be beneficial myself. Now those employees, that itself can take a lot of barriers aside and allow them to feel more comfortable because they know a trusted individual has used that program. So for those supervisors, employers out there, give the AP a call. If nothing else, it'll help you understand what your employees will experience, and you can be the greatest resource of tearing down that wall by just simply setting up a session yourself. Who doesn't have stress right now, right? So it could be a win-win situation, and to help your employees show that you're supporting them as well.
So, doctor, whether it be the patient, a loved one who's trying to help you seek care, an employer who feels like you may be a candidate to seek care, that stigma, how do we overcome that?
It's challenging because I think there's both generational differences and there's gender differences. So let's just start with generational differences. We see much less stigma in the ages from children through 30, just because of just how seeking out mental health support has become part of our culture. And in previous places where I've been employed, it's one of my doctoral placements was at Temple University, and that was the busiest college counseling center in the country, because it was just a generation of kids who grew up, checking in with a psychologist or a therapist as just part of what was like standard healthcare. And that may not always be a good thing. There's some downsides to that as well. But I think what we have to look at is men, especially middle-aged men. From my generation, I'm 44 years old upwards. I remember being, a teenager. There was stigma around going to see a counselor or a psychologist. And then there's just messages, gender-wise, for men, like that could be viewed as a weakness in some way. And that's why we see, some of the highest rates of completed suicide and alcoholism are in like middle-aged men. And that's problematic. I also want to, acknowledge that there's other ways of seeking support other than a mental health professional. There's clergy, there's just physicians or trusted people in your life in different cultures kind of seek out and have traditionally sought out mental health support in various ways. There's words that are used in society that I think increase stigma, and they're so widely used. I don't like the term mental illness. It tends to communicate to the general population and culture that there's something broken within you, like it's a brain illness of some sort. And there's been research that it's associated with danger, and then it creates like an in-group and an out-group. We should be talking about mental health in the same terms we just talk about all health. They're not distinguished from each other. They're all related. So if you have increased related stress, we're talking about hypertension. We're talking about heart-related problems. We're talking about decreased immunity. There's so many things that are related to how we manage stress and environmental stressors and losses that exist in our life that are like really impactful on our longevity and our quality of life. And so we haven't broken down those barriers enough just to talk about things in terms of health. And that means our mental well-being, the quality of our relationships, very much need to be integrated with diet and other lifestyle factors.
You know, I had a conversation the other day and you just reminded me of it, Doctor. I want to ask you this question. And when you mentioned the mental illness, it made me think of this. You know, the question became, dare I say, mental illness. Is it something that is purely from your environment, right? Dealing with all these stresses? Is there a chemical imbalance? That is what I used to always hear when we were kids, but hey, he's got a chemical imbalance. What does all that mean? And if you don't mind, what is the difference?
Yeah, I'll explain it to you. Unfortunately, a lot of things have happened in society and become popular culture that are more represented to, special interests and financial gains rather than actual science. One of those is this idea of chemical imbalance. That was a theory developed mostly by drug companies to push a lot of these drugs to market. It has been debunked medically. Every major medical organization, psychological organization does not utilize those words. We have no scientific evidence to support depression, anxiety, or many of the mental health conditions that are popular in our culture are typical are related to a lack of a certain neurotransmitter or chemical. It's all false, but it drives people into seeking out a pharmaceutical to try to correct a problem. I could have an entire, couple hours talking about this subject, but the most important thing to know is understanding that brain and environment work, in concert with each other. The idea that somehow that we have this broken system that needs to be corrected is false. It's a false narrative. It's not supported by any evidence. And so much about our pharmaceutical or medicalized culture is actually problematic and more impairing than it is helpful. And you'd have to be into the science to understand that. Now, I want to be able to say that for some people, there's a benefit and a need. It could stabilize a condition. It could be life-changing in some circumstances. The problem, though, is we've generalized it to the entire population of people. And there's a psychiatrist by the name of Alan Francis, who was on the original development of the DSM, wrote a book called Saving Normal. We just continue to create more and more disorders, and we don't understand what is normal anymore. And so, I said, I wasn't being facetious when I said the best, antidepressant that ever exists is exercises. So if you go out in sun and go for a walk or a jog or something, you are changing your chemicals of your brain, increases a dopamine, serotonin, a number of things. They're pleasure chemicals, right? So we have this ability through our own environment to be able to change these things. Love is another one. Just compassion and love have impacts on what we would deem pleasure chemicals, but it's complicated. We haven't even identified all the neurochemicals that exist in well-being. We are complex people. And there's been a reductionist movement that exists in understanding mental health that is trying to, bring things down to the simplest common denominator. And so even how these questions are framed, is it environment or is it chemical imbalance? Is back to this nature versus nurture kind of question. And I'm just going to say, well, it's always both. It's what we bring in genetically into our world in combination with our environment. There's an entire field of epigenetics, which means that we've evolved, and there are within our DNA to survive. There are certain aspects that are coded in our genes that will be expressed if the environmental conditions play itself out. Meaning, anxiety, for example, is our body's response to a potential threat, and it's designed to help us solve problems, fight, flight, survive. It's a survival mechanism. But it's only in the last 25, 30 years that we viewed anxiety to be like a symptom of an illness and the way that we talk about it. And so what's interesting is when you view anything that happens within you internally, a mood state, anxiety, thoughts, from the lens of it is something within me that is broken, it intensifies that reaction and impairs coping. So, the idea of even thinking about things from that lens is really problematic in our culture. We have a tremendous increase in people turning to psychiatric medications, 75% being prescribed by primary care physicians. And those primary care physicians do not have the training or background to assess or treat. And I'll finish on this. You know, as a clinical psychologist, it takes me hours and hours and weeks to begin to understand somebody. And that's with between session homework, gathering information to understand the context in which the problems exist. And even then, sometimes I don't get information 3 to 6 months out that is brand new that somebody chooses to tell me in that particular moment. So the idea of being able to prescribe or diagnose in a 15, 20-minute session is part of the problem. It's not a solution.
So many thoughts. That was fascinating. So many thoughts running through my head, but I got to get this joke in, right? You say, you know, love and exercise. I'm thinking of the Beatles song, right? All we need is love. And Ringo wanted to throw in exercise and Paul wouldn't let him. It seems so simple, right? But I saw both John and Meloney shaking their heads during that answer, Doctor. And I want to hear what your thoughts are and comment on what Doctor just had to say. John, why don't you go first?
Yeah, and again, you could just, you shared a lot there, Bill. Could you just clarify again what the actual question is? I appreciate it.
Well, my original question, I believe, because Roger, it was about the chemical versus environmental influences on our mental health. And I think, I don't want to speak for the doctor here, but I think pretty much we dispelled the myth of chemical being an issue. Am I right in saying that, Doctor?
What I'm going to say is it's much more complex than that. And I would support that scientifically, we've never been able to confirm, you know, any of that exists. And they were theories that are essentially debunked. Many of the medications that are provided, we have an idea about what they may do. And a lot of the terms that we use, like antidepressant, there's no such thing as an antidepressant. There's no way one can take a pill and you can go from a depressive episode to a non-depressive episode. What we're doing is we're changing physiology and you're altering experience. And for a small group of people, that seems to have some effect. And the most people who take that, we don't see an effect at all, or worse, we see impairing and significant side effects. So my message here is there's a difference between what is cultural or what is driven by pharmaceutical marketing and then what is actually scientific. And we don't know, most people don't know what the range of normal actually exists.
So I don't know, John, if you had any thoughts on that at all?
Yeah, so from an EAP standpoint, I mean, we're going to encourage that employee is getting the counseling to take the advice from their clinician. If it's a clinical psychologist, whoever it is, not only is it not my job, but it's not any of our employees at the AP to give that type of counsel or regarding medication or any of those things. We encourage them to take the advice of their clinician. And that's the safest way, you know. And again, if I can just echo the words, we are in a society, we get a lot of this. So I oversee business development and marketing nationwide, and I get questions about, you know, who can I see? Or because I work with a lot of benefit advisors, they ask me directly, can you refer me to someone so I can get medication? And I tell them, you know, again, I do not have anywhere near the background expertise as Dr. McFillin, but to echo his words, you know, we look for these quick fixes in any area of our health. We cannot look at it like driving through a fast food restaurant. I understand when stress is high, we want some immediate results, but sometimes we don't even know what's best for us. And it might take several weeks for us to figure out what's really going on because we weren't aware of all the other stressors. Again, to echo the doctor's words. So I could only say, you know, to encourage those employers and employees, don't just immediately go to look for a quick fix. Trust a clinician, trust the provider you're working with to give you that advice. And it might take some time. You know, no one becomes a professional bodybuilder in physical health. That takes time, building nutrition, working out and building your body up to these things. In a lot of ways, I believe it's the same way in mental health. There's things that need to be strengthened, need to be addressed, practices, routines. There's a lot more involved than just merely taking a pill. So that's our perspective in the AP.
And thank you, John. I want to get to some questions from some of the folks that are in attendance. But before I do that, I'm going to start with you, Melanie. I just one question for the three of you, but I'll start with Melanie again. And that question is, as an employer, what kinds of things can we do to try to relieve some of the stress, right? I mean, listen, you have to work in order to get paid, in order to pay our bills, right? So we all have a job to do here. But what kind of just little things can we do as an employer to take some of that stress off of our folks? I'll tell you, for example, some of the things we do here, we are extremely flexible during these times. When I say extremely flexible, somebody shows up a half hour late. Honestly, I don't say a word. I get it. We're all stressed. We're all burned out. They want to leave early. You don't even have to ask. Get your work done and do what you need to do. We'll buy lunches on a regular basis. Whatever we can do, all those little things, and we constantly ask, what can we do to make your job easier? Just to have that conversation with them, I think, has got to be helpful to them. But again, Melanie, starting with you, what kind of things can you think of that we can do as an employer to relieve some of that stress and make the daily grind not such a grind anymore?
So, what you just said really resonated with me as far as listening. One of the most important things that we can do is send a message that we do care about the stress. We do care that things are not normal right now, and that there's some stress with trying to educate your child virtually. There's some stress with stepping into the role of teacher. There's some stress with calendars and schedules with what's going on in people's lives right now. So I think that one of the most important things that we can do, it's not business as usual. So we can't say, look, just go do your job, figure it out. No, we have to be open to hearing what those stressors are, with some compassion, with some caring, and even with some I'd say creativity. Let's figure out how we can make this work. And so I think that's one of the first things. And then I think the second thing is you mentioned it just now, is flexibility. We cannot afford to be stringent. It's not business as usual. We cannot be, we've got to bring some extra flexibility to the table. We can't look at a job and say, well, there's no way this job can work from home. The question is, how can this job work from home? The question is, how can we adjust the schedule in order to accommodate the needs of this family? Because if they have a child at home, for instance, that needs to be educated, it is what it is. We have to figure it out. So I think that another thing is that flexibility. And I think we have to think differently about how work gets done. What we've got to really prioritize what is absolutely essential and what can wait until next week. And I think that takes a little bit of the stress off of the employee, so that people aren't under so much pressure to be perfect, as there has been in the past. And I think those are important as well. Another thing that we do that I think is very helpful is in our wellness program. So we do provide, in our wellness program, we incorporate information that can help people cope with some of the stresses. So we do provide information about sleep patterns, information about, suicide prevention, information beyond just your regular wellness. You get a discount on your exercise program, smoking cessation. We do. Now we've had to pivot and bring that material, that information. We've had to bring it in virtually now, but it is important to give people tools, to give them information, to give them ideas in order to cope with these stressors that they're dealing with. So I think those are some important things. And another thing that we did when we were in the heat of the pandemic, when it first started, we partnered with the EAP to provide on-demand access for our first responders. We've got folks going out, the EMTs going out on ambulances. They can't work from home. They can't, they're going to be exposed to it. And so I can't really call it anxiety because I'm not in a position to make a diagnosis, but there were people who were afraid because they were more exposed. And so we were able to work with our EAP to provide on-demand emergency access for those first responders. And then it's also, I think the last thing that's really important is to let our employees know what we are doing to protect them. So we've increased our sanitation in order to protect them from the pandemic. We have gone to great measures to provide for social distancing, not just the flexibility, but also our physical location looks different. There are barriers between them and, and each other, and also, people coming in to get things done. But it's important to let our employees know that we care that you're safe. We're doing everything that we can to make sure that you feel safe. And if anyone does not feel safe, we can't poo-poo that. We need to talk it through with them and figure out what additional measures can we do to help that person. So I think those are some things that we're doing in the city, and some things that employers can do to help people through these stressors. This is not business as usual. There are so many things going on. And again, as was mentioned earlier, it's not just the pandemic. We've also got the civil unrest. We've got the political issues that are out there. But as much as we can do as an employer to let them know we care, and we are doing everything that we can to make sure that you are safe.
And communication is a key part of that. Thank you very much. So I'm not going to ask Dr. and John to answer that question, because I want to get to the Q&A now, because I'm getting questions. And some may be specific to one of you. I'll see if I can make sense of that as we go through them. But I think we already answered this one. With the advent of telemedicine, do you see a greater benefit for diagnosis and treatment of mental illnesses with this platform? Doctor, what do you think about that?
So what I'm going to say is it provides us, greater ability to help more people. I want to acknowledge the limitations of trying to do an interview and assess through telehealth. One aspect of being a mental health professional, or one of my unique talents as a psychologist, is my ability to read somebody, both in their nonverbals, their presentations, to take a lot of information and be able to synthesize it in a direction. And there is something lost in that when it's through a screen. And we also know how important the development of a relationship is with your provider, whether you're a counselor, or a social worker, or a psychologist or a psychiatrist. There's a relationship factor that's really important in being able to help someone through difficult times. So we have to know more about the development of a relationship through a screen. And I think there's a lot of things about that are unknown. But I'll refer back to my previous answers. We do have some ongoing data and information that says that we can really help somebody through telehealth in similar ways that are in person. I think it's just, the question is always going to depend. It's going to be for who, at what time, under what conditions. And those are the answers that I think are going to come to us in time as we really evaluate this.
Very good. Thank you. Next one. I'm getting the word empathy in a few questions here. As employers think about making mental health for employees a priority, I think about defining this focus as organizational empathy. To what extent are companies willing and able to more actively put themselves in their people's shoes to meet them where they are? That's a deep question. I don't know where to even start with that one, but anyone want to take that on?
I'll take that. I agree. I agree that empathy is necessary. I agree that as leaders, I mentioned earlier, we are the stewards of the workforce. I mean, the people, you cannot get the results that you need to get as a business, as a government organization, as a nonprofit, without your people. And it's not just their bodies and their hands. They need to be engaged, they need to know that they are more than just a cog in some business wheel to you as an organization. So that word empathy, I think that's a powerful word. I think it's really important. And that's why it's important to take that step back and try to understand, where is this person coming from? What do they need? You can't, people will come in and ask for all kinds of things. Maybe there are stressors in the workforce that are coming into play. And so you're not going to be able to give every employee everything that they ask for. However, to take a step back and try to see it through their perspective and try to understand, where are they coming from and what do they need in order to be productive and in order to be engaged. I think it's worth the effort.
Terrific. So Melanie, I'm going to stay with you for a moment, because you love the word empathy so much. Given the diversity of workplace environments and job roles, what are ways organizations can build their state of organizational empathy beyond mental health prioritization?
That is a great question. And I think with the kind of social unrest that's going on right now there's a lot of kind of thought around diversity, inclusion, equity. And I think that people are becoming a lot more aware of some of those issues. I think it's important for the workforce. Again, it goes back to trying to understand people's experience through their eyes. It is important, I think, training and conversations and you went to look deeply into our practices to make sure that we do have practices that support equity, to be open to the conversations, to actually generate that dialogue in some cases. Let's look at our practices. Do we have any, are there microaggressions that are happening in our workforce that we should be addressing that we may have poo-pooed in the past? And we're recognizing that those things make or break your culture. Connecting with people who are different in the workplace and trying to understand what their experience has been. I think it's really having some of those tough conversations. One of, I'd say the really positive impact of the social unrest is that conversations are happening about issues that have been either ignored or swept under the rug for decades. So I think that it is really critical for organizations, for employers to provide safety and space to have those conversations and to be open to differing perspectives and understand what we can do. How can we as an employer ensure that that the diversity in our workplace is beyond skin deep?
Right, right. Let me ask you this though: can we go too far as an employer if we have, let's say, one employee who has been somewhat controversial in our office? Are they? How do I ask this question? When is allowing? Is it possible to give too much empathy at the risk of losing or alienating other employees? I guess that's really how I want to ask the question.
So I think controversial is in the eyes of the beholder. Sometimes controversial looks like somebody with a different opinion. So if you have 19 people with one opinion and the 20th person has a different opinion, then that's controversial. So can we go too far? I think what goes too far is when the issue becomes so disruptive that performance can't happen. And I think that, getting to a place where we're still performing, we're getting the work done, I think that's important. But I also think that when we have someone with a differing opinion that's so different than what has been the standard opinion for many years, it feels disruptive. It feels uncomfortable. Those 19 that may be feeling alienated, it's because the workplace was always comfortable for them. And the one who now is able to be comfortable saying, hey, this practice doesn't really work for me. Now they're comfortable saying it. It's not going to be comfortable. So the idea is not to alienate the 19, but the idea is to be able to pull everyone into the conversation and try to see it a little bit differently, because had I been in that person's shoes, then I may have also very likely felt the same way or very similarly. And even if I haven't, felt that, even if I would have seen it differently, I need to respect their experience. I think that what's going on in our country now is opening the door for people to share their experience. So up until now, people who have felt disenfranchised have been afraid to say it, have been afraid to confront issues. But because of where we are right now in our society, those doors are opening. We don't want to slam them shut by saying, you know what, you sound a little too controversial, or you're going to alienate those people, those other 19 who are already comfortable with the way things are. I think employers it's a great opportunity for us to start these dialogues and to create a safe space for them.
Meloney, I'm no expert, but I think you nailed that one. Thank you. That was excellent. That was excellent. John, I want to turn to you for a minute. What are some ways that programs in this area can be monitored by companies and measured for success? Any thoughts on that, John?
Yeah, so utilization is a big part of the process. Utilization means many different things to different EAPs. So counseling is one of those pieces, as well as whatever technology that EAP provider is using to engage that employee on the daily basis. We've heard a number of people speak about trainings. Dealing with things before they become larger issues is very helpful in being proactive. So how to measure those things? I mean, looking at the overall of what's going on in your organization. We are in a world today where communication is cutting edge, right? But are we communicating any better at one-to-one? Listening skills have deteriorated, in my own personal belief, in business and life. I've had to remind myself to put down my phone and look at someone in the face on whether it's a Zoom call, wherever, and not just hear them, but show that I'm listening, that I'm processing, I'm actually engaging with them and understanding their perspective. So as you want to look and assess what's going on in your company, I'd say the first thing employers really need to do, and again, I know this is what Meloney has been talking about, not just hearing them out, but listening to their perspective. Certainly we're going to be in a world, and thankfully so, that we can agree to disagree at times, but we should still be hearing them, processing, listening to what's going on. That'll give a better understanding of what the culture is, to get a better assessment from that employer, but also bringing in that EAP to do an assessment, to run the assessments with the employees, with the leadership. And again, there's lots of issues that I could go off on in there, but just to be succinct there, Bill, that's, I think, a good starting point is understanding and awareness. We oftentimes have false ideas of where things are and where they're headed. A good beginning is listening.
Excellent. Dr. Meloney alluded to first responders in the city of Allentown and working with them and the issues that they face. There's one question here I think I'll turn to you for, though. What are some recommendations on how to assist with first responders who may be dealing with COVID patients daily and being at risk themselves on a daily basis? So we talk about that from helping them manage stress, I guess, perhaps, is the question. What are your thoughts on that, Doctor?
So first, I want to acknowledge that I believe that there are individual differences that exist. And whenever we begin to think about painting with broad strokes with people, that we have to be careful of making recommendations that are broadly provided. First responders. There are a lot of people who are put on this earth to be the first person in response to emergency situations. They have tremendous resilience, and I find that their purpose is just for that. And a life without that would be one that would be difficult to live. So we have to be careful of, one, fragilizing those situations, because I don't think many people view it that way. On the other hand, there are people that we believe that are maybe more vulnerable to developing post-traumatic stress-like symptoms and experiences. And that could be based on many factors. Those factors could be related to previous experiences in their lifetime, the degree of the trauma that they're experiencing, and the amount could be overloading their stress system. So I want to go back to what Mel said. I thought that was so well articulated, but it's this idea of listening and understanding. Right. So the people who are on the front lines are going to start exhibiting symptoms or problems that are going to demonstrate that they're feeling overwhelmed by the experience. And it could go back to a lot of the things we talked about previously. It could be differences in sleep, mood, the way they interact. You can just notice differences. And in the workplace, you're on the front lines and you're observing each other. And if you have a culture that's caring and taking care of one another, often the people who are going to observe that first are colleagues. And so if you do have a system that's set up to refer them to a professional for some evaluation, well, then you can provide the appropriate intervention. We have really strong treatments for post-traumatic stress. And when it's implemented and provided in a safe, effective, and scientifically sound, compassionate way, people recover. It goes back to my earlier statement on the natural resiliency of human beings. To get to this point in evolution, we've had to undergo and survive many stressful situations. So I do want to end my statement by saying we have this tremendous ability to recover from trauma and loss. And at the same time, we have to have a culture or an environment that helps identify those who are really struggling and direct them to the appropriate resources.
Terrific. I got time for one more question. First, I want to thank the three of you for being part of this. This has been a fascinating conversation. It's mind-blowing. Maybe I shouldn't say it that way, but it has been a fantastic conversation. One more question is, how should employers establish boundaries for the extent to which they can meet their people where they are? How should the employers establish a boundary? Mel, do you have any thoughts on that?
Well, I mean, the bottom line is we're here to perform a function or there's a business objective here. And so I do believe that we need to listen, that we need to do what we can to support a person through whatever the situation is. But the bottom line is that there is work to be done. There are performance expectations. People deserve to have some opportunities to change their behavior. They have an opportunity to get the help that they need. But when it comes to the point that after one or two chances to change that behavior or to get the help that they need, we have to draw the line at performance expectations. I think that it's only fair to be very clear what those expectations are, to be very clear about expected timelines. And so the where you actually draw the line, I think that a lot of that has to do with the culture of the organization that you're in. I mean, I've worked in the pharmaceutical industry where the margin for error was very small. So one or two issues and the person wasn't going to be working there anymore. But in other organizational cultures, you can draw the line a little bit further out the timeline, and where you draw that line, I think really depends on the culture of the organization.
Thank you. Melanie, Dr. John, I can't thank you guys enough, ladies enough, for being part of this today. It's such a timely topic. This information is going to be extremely useful to all of our audience. I want to thank the audience and the members for joining us today. But again, thank you to my panelists. I can't thank you enough for contributing today and taking your time out of your day. I'll turn it over now to Ann Baum to close the summit. Ann, come on up. Thank you.
Thank you, Bill. I am so pleased to introduce to all of you a special treat. To close out our program, I'd like to introduce Dr. Jennifer Chambers, the Chief Medical Officer for Capital Blue Cross. Dr. Chambers?
Thank you so much, Ann. And wow, what a wealth of information that was presented. A very special thank you to the panelists and all of those who attended virtually, as well as to those of you who joined Capital Blue Cross in sponsoring this event. At Capital Blue Cross, our mission is to improve the health and well-being of the people that live in our communities. And mental health is as critical a component of overall health as our physical health. Our panel today shared important perspectives for all of us to consider as we work to support and encourage our employees to seek mental health services and support. As employers, it's up to us to help remove the stigma that's associated with receiving mental health services and substance abuse services. One of the most important things I think we learned is that we need to be very forthright with taking a step back, making sure that we're flexible as individuals, as well as employers, and being flexible with the way that we schedule the work that we do. Things that don't have to be prioritized today can be prioritized a little bit later so that we can really balance our lives during this incredibly difficult time of a pandemic. Stress, anxiety, and depression are just so common right now. And all of us are dealing with various aspects of those challenges. You know, we don't want people to feel like they have to work so constantly that it takes that toll on their mental health. So remember that flexibility as you move forward as an individual and as an employer. Remember always that we are not two individuals, one with mental, one with physical health. We're one person, and our mental health is part of our overall physical health as well. I'm hoping that each of you has a wonderful day, and thank you so much for participating. We look forward to seeing you in person next year.